Hi everyone, welcome. Today I'm joined by Dr. Cheung of Cogency and Dr. Shannon Magari of Colden. Dr. Cheung is the founder and president of Cogency and is one of the nation's foremost experts in his field. Has led hundreds of environmental and toxicology investigations, protecting thousands of occupants and saving organizations millions of dollars. A former Maryland State Medical Director, he is a faculty member at the University of Pennsylvania, the Perelman School of Medicine. As a fellow of the American College of Environmental Medicine, he is nationally recognized as an expert in respiratory environmental medicine, plant and indoor environmental quality, risk communication, and medical advisory services. Board certified in both internal medicine and preventive medicine, he holds a master's in public health from Johns Hopkins and has a medical degree from the University of Maryland. Dr. Shannon Magari is Principal and Vice President of Health Services of Colden. She serves as Vice President in Health Services and Chairman of the Litigation Support Practice, aids clients in determining the origin and nature of workplace health concerns, and provides litigation support in suspected cases of occupationally and environmentally induced illnesses. Over the course of 15 years, Dr. Magari has evaluated a myriad of industrial and non-industrial settings in a wide range of health effects. She has investigated occupational environmental clusters involving reproductive, cancer, cardiovascular, and respiratory illness. Dr. Magari holds a Doctor of Science in Environmental Health from Harvard University with a concentration in occupational epidemiology. Her thesis focused on evaluating the cardiovascular health effects of airborne particulate in air pollution. Also holds a Master's of Public Health in Epidemiology and Biostatistics from Boston University, a Master's of Science in Engineering Science from Dartmouth College, and a Bachelor of Science in Bioengineering from Syracuse University. Thank you both for joining us today. We really appreciate you being here. Have a couple of questions that we'd like to be able to ask you in your areas of expertise, especially commonly asked questions regarding COVID-19, as well as a more in-depth look in areas considered. So thank you both for being here.
Thank you, Beth.
Thank you.
All right, Dr. Cheung, I'm going to start with you first. Could you please give us a little bit of detail on how the virus is actually transmitted?
Yes, well, in the beginning, we noticed a cluster of pneumonias in Wuhan, China, mainly associated with a wet market that sold live animals. And starting in January, we noticed cases that were not linked directly to the market anymore, and that proportion grew and grew. And that's when we realized there was person-to-person transmission. The main mode of transmission is really by aerosol droplets when we sneeze and cough, or micro mists, micro sprays when we're talking, just like this. The other is contact transmission. It may be touching of the, say, eyes, nose, mouth, and things like that, as well as what we call foam-mite transmission, F-O-M-I-T-E, which is a transmission via inanimate objects such as various surfaces or pens and clipboards and towels and things like that, and they become a transfer vehicle when there is infected material on there. As far as distance, and you hear a lot about social distancing, the typical scenario for this type of transmission is about 6 feet, although we know that the mists and microsprays can hang in the air, and that can certainly travel a little bit. So you may hear some groups that recommend about 10 feet as far as distance. And we also notice that in chamber studies that these aerosols and all can remain viable in the air for about 3 hours. So those are things to consider as you kind of set out your risk assessment and plans for the workplace.
Thank you. Dr. Magari, do you have anything to add to that?
No, I think that was really good. I think the important part is really understanding that social distancing is a minimum of 6 feet. The more, the better.
Thank you. So Dr. Magari, next question for you. Dr. Cheung referenced that the virus can live on surfaces. Can you tell us how long they typically survive on surfaces and what type of surfaces have different shelf life, so to speak?
Sure. It's a great question. So the survivability of the virus on the surface of anything, different materials, really depends upon a few things. The first of which is how much virus was deposited to begin with, and then relative humidity and temperature. Okay, so we've got two nice recent studies here just this year that have come out very quickly. One was a letter in the New England Journal of Medicine at the end of March, and then another study that actually was a really nice meta-analysis of 22 other studies looking at other types of envelope viruses and their survivability. On various surfaces, plastics and stainless steel, we're looking at about 3 days. For cardboard, paper surfaces, probably closer to 24 hours. We do have estimates on plastic that say a few hours for this SARS-CoV-2, a little bit longer, and some of the other envelope viruses. We still don't have a lot of data on fabrics and other types of surfaces, soft surfaces, porous surfaces. Hopefully those data will be coming in very quickly.
Great, thank you very much for that. Dr. Cheung, do you have anything to add to that?
No, and you know, we often are also asked about how you disinfect these items and potential surfaces after maybe an employee has been injured or ill. So these are actually great sets of information and survival on different surfaces so that it help you make some cleaning and disinfection decisions.
Thank you. So keeping in mind, obviously, we know how the virus is transmitted. We know that it could last on certain surfaces for a long time. One of the other questions that continually comes up that there's a lot of confusion around is, what are some of the symptoms that we should be looking for in terms of this virus? And what are the ranges of diseases that we should be aware of with this virus?
Right. Again, this is a novel virus, so we don't have a lot of information on it, but based on the data coming out of China, it appears that 81% of the symptomatic cases are pretty mild. Another 14% is in the severe category with a lot of symptoms such as shortness of breath, poor oxygenation, and lung involvement or lung injuries. And then you have about 5% of the cases that are considered critical, where there is shock or multi-organ failure or even leading to death. The case fatality rate coming out of China is about 2%. Now, of course, there's also a question of, well, what is the percentage of individuals without symptoms that may be cases? Based on a recent cruise ship data or investigation, I would say that data shows that about half of the individuals who were diagnosed by laboratory testing actually had no symptoms. Now, some of them did subsequently develop symptoms. So there may be folks walking around who are asymptomatic, who actually are what we consider infected and may be contagious or infectious. So Dr. Fauci recently estimated that there may be a quarter, 25 to 50% of those infected cases that are asymptomatic. So that is the range of a disease that we know now.
Thank you very much for that very concise answer, because I think that's one of the things that is most troubling is there's no one place to get all the concise information that people tend to want to ask. Dr. Magari, do you have anything to add to that particular outline that Dr. Cheung just gave us?
No, I don't, not on that one.
Great, thank you. Next question is actually for you again, Dr. Magari. In terms of surface life and how it can be transmitted, which is obviously the airborne, and I'm touching my glasses, I promise. Obviously, the airborne can be on surfaces. Should we as individuals be concerned about touching products? Like, can we handle our mail? Can we handle packages that are delivered? When, and not just in our work environments, but in our home environments. Are there any guidance that you can give us on that?
Sure. Great questions for both work and home. So I've got a lot of questions lately on the mail. The nice information that we got from the last New England Journal of Medicine study said 24 hours survivability on cardboard. They didn't have paper specifically, but I think it's safe to say after a letter or package is posted, it's 2 or 3 days in transit, and the carrier wasn't infected, I think you're probably fine. In an abundance of caution, you could leave the mail to set for a day. You might even feel free to leave the bills for 2 days, and take the tincture of time away from those types of packages. Again, getting groceries and those types of things in an abundance of caution. I know some folks are wiping them down. The viral load that would be deposited on them, for instance, from an infected worker stocking the shelves could potentially be low. Again, people coughing on the groceries in the grocery store, viral load might be low. But with survivability in plastics, in the day to 2, maybe 3 days at the outset, a wipe on the way in the door might be okay. And if you were super concerned or fell into a vulnerable population, it might be a great idea, but I don't think we need to worry about it tremendously. I think the most important point here is to emphasize the cornerstone of public health, which is good, consistent hand washing. So after handling the mail, after handling packages and such, putting them away, making sure you're washing your hands for a good 20 seconds with soap and water.
Thank you. Dr. Cheung, do you have anything to add to that as well? Any other precautions that we should be considering?
Sure, and I thought that was actually very thorough, very comprehensive review of that topic. I would also add that the survivability also typically for a lot of the viruses is also the inoculum or the size of the amount of virus there, and also whether it's protected, if it was under some biofilm or soil or even fecal matter that may be protecting it. So those are the things that keep in mind, but typically not, something we see in mail or grocery packages. But as you are cleaning or disinfecting surfaces, those things are to keep in mind, and that you really need some good elbow grease to kind of really tackle those issues and not just kind of spray some type of topical disinfectant.
Thank you for that. Now, a follow-up to that, though, is some of the protective measures that are, well, for lack of a better word, people are hoarding, such as face masks and gloves and other materials. Do you recommend using those materials, Dr. Cheung, in terms of wearing a face mask? Is there certain places where that practice should be in play? Does it matter what kind of face mask that you would use, or what type of glove? If there's anything that we could do in addition to not just the hand washing and wiping down.
Right, and I would reiterate what Dr. Magari said about this. It's really good basic hand hygiene that's really going to affect the transmission and protecting yourself. Certainly there are, as we said earlier, talked about earlier about the mode of transmission. It's typically from aerosol and from inanimate objects. So those are things that you need to think about. However, I need to take a step back. Wearing a face mask really has very limited value in protecting the wearer, okay? So the important thing to think about is are there ways to minimize the debris field when you sneeze and cough, or when you know, the microsprays when you talk? And that's why, you know, maybe a face mask is good in those situations to protect each other. However, other barriers, especially given the current limitations or limits in the resources, I think things like homemade face masks and bandanas are going to help you to reduce the debris field. And recall the other part of this. So that's the mechanism for barrier and protection. The other part is that we talked about, you know, there are a lot of potential asymptomatic people out there, cases out there that may be infectious, or the cases that are at pre-symptomatic stage, which are also infectious. And again, according to what Dr. Fauci is saying, maybe 25 to 50% of those cases are asymptomatic. So the prevalence of cases out there may be a lot higher, and is a lot higher than what we know, because of lack of, you know, the availability of the test kits for us to get a sense of the prevalence out there. So at the end of the day, I think wearing some type of facial barrier to kind of somewhat self-quarantine is a good public health measure. And so I think, you know, without exhausting or cannibalizing supplies that the hospitals may need, I think those are good options.
Thank you. Dr. Magari, any additions to that preventive measure?
Yeah,
Just did?
just one quick thing. We know that certainly wearing any kind of face covering at this point is probably a good idea from transmitting and containing sneezes and coughs. The other odd thing is it, I believe, also helps folks remember to not touch their face. And so, again, if we're washing our hands consistently, we're good, but it also will help folks from stopping touching their eyes, nose, and mouth, which are pretty vulnerable as well. So double help it can give us.
Great, thank you. I appreciate that information. It gives a little bit more insight as to why we need to do some of these preventive measures and the purpose behind it. I think there's a great deal of confusion on the face mask issue and why should I or should I be wearing it. So thank you for that. Dr. Magari, for again, we've been talking about cleaning, right? Not only washing hands, but there needs to be a cleaning of these surfaces when we either resume going back into our work environments or even in our own homes at this point. What are some of the things that we should be doing in our facility to make sure that we are curbing the tide of either spreading it or preventing it from being spread in the first place?
Sure. Here we really want to look to the list the EPA has put out of registered disinfectants that are effective against SARS-CoV-2. If I put on my biosafety hat, as a biosafety professional, we want to make sure when we're trying to kill any kind of bug or virus, we want to make sure that we have the right concentrations of whatever the disinfectant is, and that we have a sufficient amount of contact time to get a good kill. So with that in mind, I really want folks to grab something off the list of registered disinfectants to use, but I also want them to really read the label and understand how to dilute and how to use, what kind of concentrations they need to be using, and what kind of times they need to have contact to get a good kill. I think all of us sort of spray and then wipe away right away, where in fact some of these disinfectants need a good 30 seconds or sometimes even a minute to kill. The adage we use in the laboratory spaces is spray wipe, spray walk, so that you can get a good contact time on those. We've had a lot of questions about green cleaning. You know, are things going to be clean? Vinegar and baking soda and all these kinds of things. You know, we've got an awareness of bringing chemicals of any kind into our lives at home or at work. And again, we want to be really careful. Some of those things are great. Some household products are great. Some are not. Some just aren't at high enough concentration or won't stay around long enough, like some of the alcohols, which are volatile, to get an effective kill. So my recommendation is go to the EPA registered list.
Thank you. That's a really good resource, and I'm sure most of us wouldn't even have thought to go there. So again, I appreciate that information. Dr. Chung, do you have anything to add to that, or any other thoughts behind the cleaning process?
No, I thought that was very thorough, and I really want to reinforce the concept of the contact time and also the wiping and removing any biofilms or any layers that could protect the virus. And then, the thought, then you spray again, then you know you got it. You hear all these stories about, the norovirus and cruise ships having to re-clean or re-disinfect. And a lot of that, a lot of those failures may be really due to contact time issues.
Sorry. We basically covered a lot of information regarding what I would say are the frequently asked questions on COVID. There's always some more dive deep questions that we want to ask. And if you don't mind, I'd like to pose a few that have come our way in terms of frequently asked, and want to know if you would give us some feedback. Is that something that we can do right now?
Sure.
Okay, great, thank you. So I'm going to start again with Dr. Cheung on this one. So Dr. Cheung, workplace and those that are still open, right? There's a lot of essential businesses that are still remaining open, clearly because they're essential and we need their services. But how do those workplaces deal with possibly letting someone in that's actually visibly sick, that could be showing some symptoms, and clearly no one is a diagnostician and able to basically give that, okay, you look like you're coughing and it's not a seasonal allergy. But how can we minimize letting someone into our work environment? We had a recent example of someone came into a work lobby that looked really sick, and they wanted to get their security involved, and there was a lot of confusion on what those next steps really should look like. Do you have any guidance that you can share with us on that?
Sure. I mean, I think the first thing you need to do is perform a risk assessment and stress test it, right? You want to create various scenarios and who would respond and how that would respond. So you may get a sense that, hey, some of these folks will need some type of personal protective equipment, whether it's gloves, maybe it elevates to face mask because of other stuff, or even a respirator. So it depends on what your risk assessment tells you. But the second part of it is also trying to maybe limit the traffic within the area. So earlier we talked about the safe distance or safer distance. And so if you have, I don't know, crime scene tape that you can kind of cordon off about 10 feet from where the individual is, I understand this individual collapsed and needed 911. So then you would kind of cordon off so that you don't contaminate or cross-contaminate folks or cause an exposure to bystanders and things like that. The other part of it is a little bit of contact tracing. Ideally, if we can get some information about the individual when we call 911, that will help us kind of coordinate with the health department or even the fire department or the emergency department. We don't need to know everything about it. Ideally, we just need to say yay or nay, because it may affect, for instance, the security folks that had to handle the situation, or anybody else that walked by and tried to assist in the situation. So that type of information is very informative in making recommendations. Certainly you may initially, self-isolate and until we know, because that case sounds very suspicious for COVID-19, given what we have today. But it also creates a lot of anxiety. So if we can find out maybe it's not a case, then we can reduce the anxiety in these folks and able to, kind of have an exit strategy where they come back to the workplace and also interact with their family members.
Yeah, thank you. That is some helpful information there in terms of risk assessment. that's something that businesses and just everyone in general should be definitely aware of when they're venturing out of their home or their office space. Dr. Magari, do you have anything to add to that? Is there any measures that you've seen that work well, or anything that you'd like to suggest?
No, I think that was a great answer. If I were going to add anything, it would be making sure that employees themselves are aware of the signs and symptoms so that they're doing their own little mini self-awareness, self-assessment each morning before they even get out the door.
Great, thanks. That's important too. Again, I think information is power and key in any of these scenarios. That leads me to another question though. In terms of making your employees aware, there needs to be guidance obviously from the employers, right? And in that scenario, I want to read a question that I think is important that we consider. You know, what should my return to work policy look like for my employees, whether they fall into several categories, if they've tested positive themselves or if they've been diagnosed symptomatically but not actually tested, or perhaps they lived with or took care of someone that was diagnosed or tested positive. What should our policy look like when we do have, even for, again, it's a segmented thing here, it's a dual question. You have the essentials who this should be something that is practiced right now. And then of course you have those that are, you know, trying to make best practices when they enter back into their work environment. Do you have any suggestions that, you know, businesses might be able to start looking at to do a little bit better planning, and like Dr. Cheung had referenced, do some risk assessment and making sure that we have those plans in place?
Sure. We've absolutely got to make sure that people are healthy before they return to work, or we will have another resurgence. So, you know, we don't have another hour to answer this question, Beth, but I will tell you the return to work scenarios are complicated based upon the availability of tests. So there's test-based methods to get folks back to work, to negative tests apart from each other. We can't get tests to diagnose once. So there's a test-based method, there's a non-test-based method that largely applies to folks that are have been diagnosed positive based on symptoms or tested positive. There's strategies there to look for the resolution of symptoms and counting number of days fever-free, but there's a gap in return to work information for folks that have lived with someone who's been diagnosed positive. They may be asymptomatic themselves, but when do you start counting their 14-day period seems to be a subject of global disarray. So the World Health Organization has one metric, the National Health Service in the UK has a different metric. Our own CDC seems to be a little silent on that issue. So return to work is absolutely developing. We're trying to stay on top of that. The CDC, again, does have good guidelines if you've been diagnosed positive, or if you've had one exposure and you've left that exposure, they want you to quarantine for 14 days. But if you have lived with or taken care of someone who's positive, the guidance is a little unclear at this point.
Thank you. Yeah, I think that comes down to a number of different questions, is where do you go to your sources to get that information? So I appreciate you summarizing that and giving a real good indication as to the non-test versus test method, symptomology, and how long they've been exposed, et cetera. And thank you. Dr. Cheung, do you have anything else to add to that particular answer?
Right, and I will say there's still a lot of uncertainties. You know, we've said it repeatedly that there are folks who may be asymptomatic who are cases. So you kind of have to be cautious and use your best judgment. And the other part is that of those cases, let's say they were diagnosed, the viral shedding period appears fairly long. And some of the studies, although we don't have huge amounts of studies, they may be shedding for about 3 weeks or more after they became symptomatic. And then there's the, you know, the pre-symptomatic stage. So it may be a month, you know, altogether that these cases may be shedding. So, you know, we have to use our best judgment. We have to stay updated on the science and apply the science appropriately, really for public health measures and public health management.
Do you know if there's anything additional, Dr. Cheung, that we should be doing in terms of measures in place to protect employees now that are in the essential environment, or those that, you know, could be reentering? Is there anything, you know, more that we could be doing besides the risk management and the education piece?
Right. Again, and I want to reinforce the concept of a risk assessment, right? You know, in addition to the basics, you know, including social distancing, maybe wearing some type of face covering to minimize the, as I would say, the debris field. Maybe you should reassess whether you need everybody at the workplace, and whether you can reduce the numbers and things like that. And then as part of the risk assessment, you need to identify, you know, what's the opportunity, because you're an essential business, of meeting the public, let's say, or that there are opportunities for the virus to be around. So there's some engineering controls, maybe having a shield and a process flow so that, you know, people are going one way and not kind of cross-contaminating because they're walking towards each other, that everybody should be flowing in one direction. There are, you know, recommendations such as increasing the ventilation rate or the air exchange rate to kind of move some of the, you know, sprays off of the area. So, you know, so there are a variety of things, and it all starts with, you know, the employer's need for a risk assessment to identify those. The other part, of course, I think Shannon and I have talked about this a little bit, is cleaning. Cleaning measures are going to be very important, especially of the high touch areas, the elevator buttons, the doorknobs, the handrails that everybody else touched, and you just don't know who is, you know, infectious or not. And then there's some self, you know, hygiene issues, not so much you as an individual, other than, of course, hand washing and don't touch your face, but also if you were to use a certain chair or conference room table where it's shared, it's almost like going to the gym, right? You really should wipe it down before you use it, and you should wipe it down after you use it, so that you minimize that fomite or inanimate object transfer.
Thank you. That's a really good analogy. I think a lot of people will be able to put into play the gym analogy. So thanks for that. I know a lot of us are looking forward to getting back to one, so hopefully we'll practice those. Dr. Magari, is there anything else you'd like to add to this particular question?
I think that was a great answer. I would add, you know, since buildings have been unoccupied maybe for weeks, when this is over, we're not really sure when everyone's going back necessarily, but just to do some good house cleaning and really think about general indoor air quality. Dr. Cheung had alluded to some of the air and HVAC kinds of considerations. Those are things we're helping clients think about now. What does reopening an office space look like? What does reopening a manufacturing facility look like? Things happen when buildings sit empty for weeks on end. We also want to make sure that, you know, the softer side of things are addressed with employees when they're back to work. I think when this is all over with, everybody's going to have a different definition of clean, and we need to be sensitive to that for our employees.
Sorry, I was muted. Thank you for that. Dr. Cheung, Dr. Magari alluded to when we go back, right? Like there's going to be a when we go back phase. That's hopefully sooner than later, but eventually we will be going back. what are some of the challenges that businesses are going to be looking at? Like there's always an unintended consequence, right? Like being on the side that things are closed right now, the intended consequence is to slow COVID. But there's got to be an unintended consequence when we go back into the work environment that it's been sitting for so long. And obviously cleaning is one of them. Is there anything else that we should really be focused on or thinking about in order to make the environment healthier overall?
Sure, and we kind of have to break it out into, you know, I would say those would be the more non-essential businesses because they have kind of evacuated or they're not working at the workplace. So certainly, I think Dr. Magari mentioned this earlier, some indoor air quality issues. There may be some humidity issues, especially in areas that are ventilation starved areas, or because of the lack of, you know, folks in the building to generate heat, the amount of cooling that is required is much less now. And so what happens is without kind of prolonged cooling, the humidity may build up. So those are things that we have to keep in mind. There may be some preventive maintenance type activities that can help with that. The other thing we need to think about is that there is typically a lack of use of, say, the water or some of the water features and other things. So when that happens, then there may be issues with stagnation. Now, if you go back to some of our blogs on mold and Legionella, especially for Legionella, stagnation can cause the amplification of the bacteria. So there's some, you know, you have to kind of do that risk assessment, and there's some preventive maintenance things that may be able to prevent that from happening, or some treatments that may prevent that happening, because certainly we don't want to go back to the workplace and end up with another issue that is also respiratory that would cause a lot of confusion. So there's just some anticipation and understanding of the environment, understanding of the buildings and, say, the cooling towers and other things to kind of make sure certain preventive maintenance steps and maybe some extra steps to mitigate these from happening.
Thank you. Dr. Magari, do you have anything to add to that, or are there other concerns that we should be keeping to the forefront when we are planning on our return?
Yeah, I want to think about some of the engineering controls that we've specified. Dr. Cheung had referred to them earlier, some barriers that we've put up to splash guards or sneeze guards and things. We've been putting these out there and to get people that still are working, that may come back to work. We want to get them sort of socially distanced even while they have to work next to each other. And what I'm seeing is a lot of knee-jerk reaction. So we're doing as much as we can, but we want to make sure that as we're introducing these controls, we aren't sideways introducing another hazard. For instance, we're putting up barriers every place. We want to make sure that those barriers aren't blocking egress, or that some curtains or shields couldn't get entrained in machinery and things like this. And so when we get back to a little bit more of a new normal, we start phasing folks back in, I want to really think about good old-fashioned safety. We've been so focused on the biological hazard, I want to make sure that we're not losing sight of, you know, our chemical and physical hazards as well. So it's just a realignment of a reset on a more holistic approach to health and safety in the workplace, with a focus on COVID-19 prevention, but making sure we're not losing sight of some of the other basics.
Thank you. I appreciate that. That is definitely, again, it seems that the three commonalities of everything we've discussed today fall into good hand washing and knowing the symptoms, knowing what's going on in terms of what to look for. Just to be mindful of the workspace and how things could, the virus can last on certain surfaces. And lastly, a risk assessment of some kind, that we need to make sure that as employers and as employees, we're following those guidelines, getting that information, and making something that works best for us in our work environments. With all that being said, although it was nicely summarized right there, it's overwhelming. As a business owner, these things can be very overwhelming. Do either of you or both of you offer these support services to help businesses either get back into a good plan of action when they return, or if something happens, like best laid plans and something went sideways? Do you have services available in order to support businesses in their ongoing efforts? And I'll start with you first, Dr. Magari, and then Dr. Cheung, if you want to chime in too. But do you have those available packages, or, you know, just support?
Sure. Sure, we sure do, Beth. I am backed up at Colden by a wonderful team of toxicologists and certified industrial hygienists and certified safety professionals who are experts at recognizing and controlling hazards in the workplace. And so that's what we do. That's our bread and butter. Again, whether we're thinking about chemical, physical, or biological agents.
Wonderful. Well, thank you. That was wonderful. How about you, Dr. Cheung? Does Cogency offer support services?
We do, and we offer, you know, similar services and similar level of skills and knowledge, and that's why the combination of Cogency and Colden provides good geographic coverage as a nice alliance or partnership in this. And the other thing about it that I want to emphasize, which I'm sure Dr. Magari does as well, is the fact that we stay on top of the latest news and studies and see how that affects the workplace. And that's the value we bring to the relationship to our clients, is to say, hey, you need to plan X number of months or X number of years because of this new normal and new baseline that's going to be reset. And how do you, you know, increase resiliency for your business, and how do you maintain, you know, productivity, and what do you have to do, and how to use the latest technology, you know, whether, you know, I know in a lot of the countries they use a temperature check. Is that enough? Because, you know, 20 to 40% of the individuals who present even to the ER do not present with an elevated temperature. So just the temperature check may not be enough, and you need to, I'll say this time and again, there's going to be a separate, you know, a risk assessment, individual risk assessment questionnaire that may need to be answered. And as technology develops and we're getting into the 10-minute antibody checks and things like that I'm seeing coming down. So those are things that could be implemented where we can, especially for the highly critical infrastructure settings where they must be open, how do you screen access into those places? So those are the things that our organizations offer, and I want to say that we are tops on this stuff, and I think we can bring a lot of value and a lot of business continuity ideas, because if we're able to present a lot of the uncertainties in a more clear sense or probability based, then you can make some business decisions and business strategies.
Thank you. Incredibly good information that's been discussed today, like just a wealth of knowledge, and I appreciate you both taking the time. I do want to take a moment and share your information. Do you mind if I do that right now so we can put up your contact info?
Great.
Alrighty. So how to contact both Dr. Magari and Dr. Cheung. Dr. Cheung with Cogency. There's the website information is directly up there, as well as a direct phone line. Same for Dr. Magari and her team at Colden. Obviously, there's always contact me pages on our website, so there's clearly a way to get in touch. There's always the handy dandy phone, which I think right now when working from home and these video conferences, they tend to forget that part. But we do have that available for both of you as well here. And again, I just wanted to take this brief moment. Thank you. I know that you're both incredibly busy with what's happening right now. And one, just staying on top of things, and two, getting information out to your clients and team, and three, taking time to do something to make sure that the greater world knows what's going on and how to handle things. It's very appreciated as a business owner to make sure. And I thank you very much for taking the time today. And I encourage anyone who is watching this to reach out. They have so much information. It's incredibly important that you have that business continuity risk assessment, keeping your business afloat, keeping your business abreast of the new information that comes out, which is fluid and constantly changing in this world, especially with COVID. And if there's any questions that you have, ask. And thank you again for joining us today.
Thank you for having us.
Thank you. Thanks.